Hello, everyone. Welcome to another special assessment or webinar for our students in LAMP. We shall continue with hypertension, management and prevention, part 3. So with our, let's get started with our assessment. Let's welcome Ma'am Trix. Good afternoon, Ma'am Trix.
Good afternoon, Doc.
Okay, you are presented with this one, the symptoms. And if you notice, um, the letters were in the most significant symptoms were in bold
Vexation,
letters. So
agitation.
as usual, we will have to look at the signs. Okay, so I think this is quite easy, no? Because if you can see, there's vexation and agitation, easily angered. Although I would like to really emphasize the red facial complexion, as well as tinnitus. And then the tongue is red at the tip, no? So with red edges. So it's tip and red edges. So you will be looking at a very, very uncontrolled liver yang here, which is already affecting the heart. No? Yellow coating, maybe loss of coating on the sides, and of course the pulse, which is wiry and rapid.
Right.
What is your diagnosis?
It's liver yang rising.
Very good. Now, um, acupuncture points. First, when we do treatment, we need to know the principle because from the principle, we can determine what points are appropriate. So first, you said the diagnosis was liver yang rising. So what are we supposed to do with the liver yang?
We clear. Oh, sorry. Clear the heat.
Okay, we bring it down. No, we down bear it. Okay, so what are the points? So obviously there's going to be headache, no?
Yes.
The headache could be throbbing most likely. So let's look at the points.
Okay.
Okay,
The
maybe
points are GB20, GB21, LI11 and stomach 36, liver 3, kidney 1, Sanjiao 5 and gallbladder 41, spleen 6, kidney 3, liver 8, liver 2.
okay, very good. We use liver gallbladder 20 because it is so effective to expel the wind. Okay, in fact, the name is feng shui. Huh? Um, it lowers the blood pressure. We use gallbladder 21 as well to descend the chi because the yang is rising. No, now if you are very observant, Li and stomach, um, they have the same polarity, diba? This is the yang ming pair for hypertension. In fact, even the location is very, very, shall we say, are parallel. No, they have the are very they correspond. No, if you locate Li11, it actually corresponds to your stomach 36. Okay, so that's a yang ming pair for hypertension. Now, livers, okay, needling liver 3, we needle liver 3 through and through up to kidney 1. Okay, have you tried?
Mm,
So you use,
no,
yeah, you
not
need
through in.
through and through. The needle
Mm.
used should be thicker, no? Oh,
Thicker and longer.
longer, of course. So, would you like to?
Masakit to. Sobrang sakit na.
So,
I
of
have,
course, you avoid naman the ano,
yes.
tuloy-tuloy lang. Oo. So liver 3 to kidney 1. Then for the young rising, we use this one. We call this the Shao Yang, no? So lesser yang. So we try to lessen the yang. So we use Sun Jiao and the gallbladder. Sun Jiao 5 and gallbladder 41. Now, 3 in crossing, ang spleen 6 because it not only um, tonifies the yin of the liver, but also the kidney and the spleen. Then we have kidney 3, which is the yuan source point on the water channel. At this point, you need a lot of water because there is so much fire, diba? So liver 8 is it nourishes and tonifies the wood channel. So we need to tonify the wood channel using liver 8. So if you remember, liver 8 is the Hussey point, no? The Hussey point. Yeah, the Hussey point, and also it's also the wood point. The wood,
Sheet left. Wait.
no,
Yes.
wood point.
Our
2 is the fire point. Okay. Next, what is the diagnosis here?
um phlegm heat affecting the heart and the liver.
Okay, obviously, because um yeah, because there's profuse phlegm and there is bitter taste in the mouth, difficulty concentrating, mental lethargy. Okay, and of course your heart palpitations, no? So this is a worse um scenario than the first one, no? So the
Yes.
tongue is pale with red tip inside and greasy yellow coating. The pulse is, of course, slippery, wiry, rapid, slippery, and pounding. So what is our treatment principle here?
Um, the acupuncture point, stomach 40, PC6, PC5 for phlegm,
Mhm.
stomach 44 for heat, stomach 8 for phlegm in the head, do 14 and do 15 to pacify wind, spleen 3 to host guests with stomach 40, the source point of phlegm.
So here we have a very useful combination of points for the phlegm. So this is specifically for phlegm that has already affected the heart. So we need to really do something about the pericardium, no? Pericardium 6, pericardium 5. Of course, we have to deal with the heat by using stomach 44. Okay. Uh,
Doctor, you can needle PC6 through and through also.
yes, to TB5. But in this case, I don't think that would be necessary
Necessary.
because the cause of the problem is the phlegm, no?
Mm.
So I think the reason why we use yeah, I think that's the use of stomach 40 would be more impactful. Of course, you combine it with the pericardium 6. Mhm. So phlegm heat. Now, next, what is the pattern here?
Liver and kidney yin deficiency.
Okay. As you can see, we have the classic yin deficiency symptoms, no? Diba? Mm. Tinnitus, blurred vision. No, actually, yung dry mouth, um, so red tender tongue with no coating, scanty or no coating. So that's very, so here you could,
Yin.
yeah, you can, just by looking at the tongue, you can actually ask the symptoms, no? So sometimes the patient will not tell you na that
All the same.
everything. It will not. So the pulse is fine, thready, which speaks a lot about yin deficiency, and and rapid. So definitely there's heat already. So what would be the acupuncture points and what would be the treatment principle?
We tonify. Mm. And
Yeah,
then
we
we use
tonify the yin of the liver and the kidneys, diba? Mhm.
and then we use Renmai, lung 7 and kidney 6, Ren 4, Ren 12, Ren 22, Ren 7, liver 3, liver 8 and kidney 10, and then lung 8 and liver 4.
Okay. So, lung 7 and kidney 6 are the coupled points for Renmai. So we need to use Renmai because this is yin deficiency. So the front is the yin, no?
Renmai.
Symptoms. So next, what would be your answer here?
Mm. Liver and kidney yin and yang deficiency with yang rising.
Okay. Yeah. So we have here a combination of yin and yang deficiency of the kidney. And of course, we all know that the kidney and the liver, they have a mutual relationship. And in this case, there's yang rising. So that means there's more, uh, it is more yin deficient than yang deficient. Okay. Yes. So the pulse is fine. Yun. So what would be your points? What would be your treatment principle?
Treatment principle is to tonify the liver and kidney.
Yes. And at the same time, because we have yin deficiency and yang deficiency, we need to consider both the ren and the chong. Okay. Then we nourish the liver and kidney yin, tonify the yang, okay, subdue the yang rising. Um, never forget to needle Ren 4 and Ren 6. I think that's self-explanatory. And then for night sweats, we use heart 6 and kidney 7. Okay. So we also use kidney 6, um, which is the very good for yin deficiency. Kidney 3, yuan source point, do 20. And then for yang rising, we have GB 21. Okay. So Ren and do you understand this? Ren and do, the front and back, no? So for the Chinese, they have a different way of doing it. They do it bilaterally. So whichever um, protocol you are very familiar with, and you do it. So other books would say for women, you use lung 7 on the right, kidney 6 on the left.
Mm.
Is it for the same thing with SI3? But I think what is important is you were able to needle the 4, no? So lung 7, kidney 6 would be the coupled points for Ren channel. That's for the yin deficiency. But for the yang deficiency, you need to needle SI3 and bladder 62. Next, what is the pattern here?
Blood stagnation in the connecting vessels.
Okay. As you can see, you know what, diba, it's always good to look at the tongue first, no? Especially when you have questions like this. It would save a lot of time. Do you agree?
Yes.
Yeah. Kasi the tongue is purplish na, oh, dark purplish tongue. And then with possible static macules and then the choppy pulse, very, very giving na. So blood stagnation in the connecting vessels. That means in the lu connecting. Okay. So what would be the treatment here?
Mhm. Uh, we use spleen 10 to invigorate blood, dispel stasis. Spleen 6 invigorates blood. Li4 and then liver 3 to regulate the Chongmai. Chongmai points spleen 4 and PC6. And then stomach 30 regulates the Chongmai. Kidney 14 regulates the Qi, moves blood stasis. Bladder 17 invigorates the blood and dispels stasis. Li11 regulates the Qi and blood, activates the channel, clears heat, and cools the blood, and stomach 36, which tonifies qi and nourishes yin and the blood.
Okay, very good. Okay, next, what is the pattern for number 11?
11 is phlegm, damp obstruction.
Okay. Again, let's look at the tongue first, no? Okay,
Thick
phlegm dump
wet.
obstruction. Mhm. Phlegm, tongue and pulse. So what would be, so I think everybody can read that, no? Mostly obese body. So diba um most Chinese practitioners will always look at the constitution first, diba? So if you have an obese person, so you would immediately think of phlegm already, phlegm tongue, no?
Mm.
So what would be the points?
Um, we can use Li11, which drains damp, stomach 36, and spleen 9, which fortifies spleen and resolves dampness. Stomach 40 for phlegm. Ren 12 fortifies the spleen. Stomach 8 for headache and blurred vision. Spleen 6, the 3 yin crossing, it resolves dampness. Spleen 3 resolves dampness and damp heat. So we use Moxa for Ren 9, and then Lung 7, Li4, PC6, PC5, and Sanjiao 3.
Okay, very good. Next, what do you think is the pattern here?
Qi and Yin deficiency.
So again, we look at the tongue, no? The tongue is fat. That means it's very swollen, pale with teeth marks, scanty to no coating. Yeah, Qi and Yin deficiency. Very good. And what would be the points?
Points is our heart 7. It regulates and tonifies the heart. PC6, stomach 36 for Qi and blood. Heart 6, it regulates the heart blood. Bladder 43, fosters yuan qi, nourishes yin, tonifies and nourishes lung, heart, kidney, spleen, and the stomach. Kidney 7, it drains damp, benefits the kidneys, and regulates the water passages. Also, we use Do20, bladder 18 for liver shu, bladder 23 for kidney shu, bladder 20 stomach, spleen shu, bladder 13 is lung shu, and bladder 15 is for heart shu.
Okay, very good. And the last one, what do you think is the pattern here?
Is yin and yang deficiency.
Okay. Yeah, yin deficiency. So possible
Yin and
dislike for cold. So this is a combination of yin and yang deficiency. But again, one will be more than the other. So what would be the treatment?
to tonify and resolve dampness.
Okay.
So we use Lumai, the SI3, bladder 62, Ren, Mai, lung 7, and kidney 6. Bladder 23 for kidney shu, Ren 6, which tonifies the kidneys, fortifies the yang. Ren 4 tonifies and nourishes kidneys.
Mhm.
Ren 8, it warms the yang and rescues collapse.
Mhm.
Stomach 36 revives yang, nourishes qi, blood, and yin. Kidney 3 nourishes the yin and tonifies the yang. Kidney 6 nourishes the kidneys, regulates yin and motility vessel. Kidney 7 benefits the kidneys, drains damp and clears damp heat. And spleen 6, which resolves dampness and harmonizes the liver and the kidney.
Okay, so that ends our assessment for hypertension. Did you enjoy the session, sir? Nag- Saan kayo ito papunta?
Yes, thank
Yeah.
you po.
Oo. So this is the way we should treat hypertensive patients, no? So next week we shall be focusing more on the Western concept of hypertension. So thank you very much. Congratulations, Mom Trix. As usual, we can see the
Thank
passion,
you.
your passion in hypertension.
Congrats, Ma'am Trex.
Congratulations.
Thank you po.